Good afternoon and welcome to our daily media briefing. Well, we made it to another Friday, and I want to thank you all for joining us. I know that this crisis has continued, and it started to feel a lot like Groundhog Day, where every day seems to be like the day before. But I'd like us all to take a deep breath and pull back a little and take a broader view of our situation. In the last 2 weeks, our region has made significant progress in stabilizing things and bringing back some of our life's pleasures that we initially lost. We were able to open up the use of beaches for swimming and surfing and walking. And when it appeared we were about to lose that access, we were able to get a reprieve from the state of California. Meanwhile, we worked with local businesses to create a framework that would allow merchants to reopen after filling out a safe reopening plan, and today, some retail businesses were allowed to reopen for curbside pickup and delivery. Today, we have more progress to announce. We had opened golf courses recently, but one thing that was missing was the ability to use golf carts. We now learn that the state is allowing the use of golf carts for single riders, no matter what their age is. That will allow more people to enjoy the spectacular golf courses that we have in the San Diego region, so I hope you get a chance to get out and enjoy them. And we have another recreation activity that we will add to the list today. We're updating our public health order to allow the use of campgrounds throughout the region, but under certain restrictions. Campgrounds may be open provided a vacant campsite separates each occupied campsite. And we are requiring that each campsite is occupied only by members of the same household. Now, these campground guidelines are for all campgrounds in the region. However, some campsites are operated by cities or the state of California. So it will be up to each jurisdiction whether they will open their campgrounds. If they do, they must meet our requirements. For County of San Diego campgrounds, you can get to our reservation portal by visiting www.sdparks.org. Please remember that our campgrounds will be at reduced capacity to ensure that we adhere to the social distancing requirements. So you're going to need a little patience. You may not be able to reserve your favorite site at a campground, or there may not be the availability for the date you're trying for, but keep trying. We'll start accepting reservations for June in a couple of weeks. As a supervisor, one of my favorite passions over the years has been to enhance our county parks and trails, and I'm really excited to share this news with you today. Actually, if you had a chance to cancel a vacation or trip, or maybe you just need to get out of the house, now would be a great time to do that. Taking a staycation and check out some of our campgrounds. We have a great team committed to positive experiences at our parks and campgrounds. And as they like to say, let's enjoy the upside of outside. Again, all of these changes over the last 2 weeks have been because we've been disciplined in maintaining social distance, wearing facial coverings, and washing our hands to slow the spread of the disease. So let's keep it going. There are some other exciting changes regarding recreation, and Supervisor Fletcher is going to cover them. So please let me introduce Supervisor Nathan Fletcher.
Thank you, and good afternoon. We've come a long way in the past 2 weeks, San Diego. If we take a moment, knowing we have a long way to go, but if we take a moment to look back, 2 weeks ago today, our beaches were closed, our parks were incredibly limited, there was no boating or outdoor recreation, and business was limited exclusively to essential services that have been open for the duration of the coronavirus pandemic. And it may not feel like it in the moment, but we have come considerably far in these past 2 weeks. We have started turning the dial, we have started easing restrictions. To date, we have done it responsibly, and we should all take a moment to recognize the progress that has been made and to commend one another on the successful transition into the very initial phases of our easing efforts. I know a lot of folks are anxious right now, and there's a desire to see more progress faster, bigger, and sooner. But the reality is the most effective thing we can do to not only rebuild our economy, but ensure that the progress that's been made and the protection of public health that has been put in place, the most important thing we can do that is to make sure that we take these next few weeks thoughtfully, strategically, safely, and really understanding the containment strategy. Understanding that we are trying to adapt our way of life, we are trying to adapt the way we go about things in an effort to ensure that we don't see outbreaks, in an effort to slow the spread, in an effort to contain the spread of coronavirus, to ensure the integrity of our healthcare system, and to have a smooth trajectory as we come out of this. We really have to be smart about what we're doing. We have done great over the past 2 weeks, and we need to continue that progress as we move forward into the future. But because of our continued progress and where we are happy to announce some changes to our public health office order that will allow some additional recreational opportunities. And then I'd like to take a minute and just reiterate and walk through the announcements that came from the governor yesterday and provide an additional explanation of what that means for us here in San Diego. As it relates to our public health change orders effective today, going in effect today, we are making a few changes primarily around outdoor recreational activities. We are adding rental for recreational items such as, but not limited to, bicycles, boats, kayaks, and surfboards, allowing rental of those entities and items so that you can go out and enjoy what is available under the existing guidance. We are also adding additional outdoor recreational opportunities similar to what we have done for golf. There is the exception, there are still no community swimming pools, as that is prohibited by a state order, but we are allowing additional outdoor recreational facilities, things like tennis courts or handball, can open, provided that they can ensure that individuals are having full compliance with physical distancing before, during, and after the activity, and it is only members of one household that are in close proximity to one another. The owner-operator of such outdoor recreational facility must prepare a safe reopening plan pursuant to what is already in place for all of our businesses that are out there. That includes a requirement that all equipment be sanitized with disinfectant effective against coronavirus immediately after each use. This also includes all of the normal components of our safe reopening plan, temperature checks and health screenings of any employees if there are, physical distancing plan. These have to be posted publicly and shared along with given to all employees. But we are taking, in a sense, the framework around golf courses and expanding that to other outdoor recreational activities in the same vein and spirit. And then Supervisor Cox mentioned campgrounds, which are being added today, open on a limited basis, limit the number of spots by half, and ensure that any individuals at one campsite are from the same household unit. We want to make sure that as we get outdoors, we continue to be responsible. We continue to be mindful of physical distancing, of face coverings where appropriate, of sanitation, and can continue the progress that we have made thus far. I also want to review the governor's order from yesterday and provide a little additional explanation about where we are today in San Diego. So let's start with our essential businesses. These essential businesses are those that have been operating and open since the beginning of the coronavirus pandemic. And let's bring up the first essential businesses there. Okay, so these essential businesses, you've been open, you've been existing the entire time. These are grocery stores and pharmacies and all of the things that were in the governor's initial executive order many months ago. You have to continue to follow the existing business plan that you've already filled out, you've already posted, you've already shared with your employees. You don't have to redo that, but you do have to add temperature screenings as soon as you can for your employees, and wellness screenings where you're looking for fever, cough, shortness of breath, chills, and exposure to anyone who is positive. So essential businesses have already posted a plan. You need to continue in that same spirit, but we do need you to add in that you're doing temperature screenings for employees as soon as you can acquire the thermometers, and that you are doing wellness screenings until such time as you're able to do temperature screenings. The reopened businesses, these are the ones that the governor added yesterday. So we in San Diego, the entire state of California is moving into the initial stages of phase 2. These are retail, and they're supporting manufacturing, logistic, and warehouse operations. These are things like bookstores, jewelry stores, toy stores, clothing stores, shoe stores, home and furnishings, sporting goods, antique, music stores, and florists. These businesses can be open starting today. The reopened businesses, in order to be up and running, we'll click to the next one here. These are for curbside and delivery only, and they must complete the county safe reopening plan. You can find this on our website at coronavirus-sd.com. Download it, fill it out, post it, share it with your employees, and make sure you're complying with all of the components in there. Those businesses are able to be open and operating today. Now, the governor has stated that the entire state of California will continue in the coming weeks to move forward into additional entities being open consistent with stage 2. And so these are things that we expect to be coming in the coming weeks. The governor has alluded to the things like this includes dine-in restaurants, shopping malls and swap meets, car washes, pet grooming, outdoor-based businesses, outdoor museums. These are things that are not allowed to be open now, but we know they've alluded to these will be coming soon. And so if you are any of these businesses, you should start your planning process now. You can download our safe reopening plan. You can look at the types of things that you might need to do in order to be in compliance with those items and start getting everything ready so that the moment that we get the word from the governor that we are allowed to move into these stages and phases, we will. Now, there was a fair amount of confusion around regional variance. Regional variance was a mechanism that the state put in place where counties could move faster than the entire state of California. San Diego County does not comply, and based on how it's written, we will never comply with this. But that doesn't mean that we aren't moving forward. We are moving forward today. I just shared with you the retail entities that are open. Again, curbside and delivery. And those are open, and you can be operating today, along with all of the corresponding logistics, supply, and warehouse-type entities. And the governor has alluded to we will quickly be moving into additional businesses opening in stage 2. So we are moving forward. The regional variance really applies to small, rural counties that are in a much different situation. They have greater flexibility. That flexibility does not apply to us, but we are continuing to move forward. Now, I'd like to get into, before I get into our charts today, we have a special day. It is Military Spouse Appreciation Day. And here at the county, we just want to take a moment to recognize the contribution and sacrifices of military spouses throughout our country. The military is a core part of who we are as a people in San Diego. It's a part of our culture, a part of our economy, a part of what makes us unique and special. We have 16 military installations here in San Diego County, some of the largest in the country, and we appreciate the individuals out there who serve in supportive roles, who keep the family going, who keep everything in line while their loved ones are deployed or on active duty. And so on this day, May 8th, we want to say a special thank you and appreciation to all of the military spouses who are out there. Quick update on the homeless stats to date. In testing, there have been 1,126 tests given at the convention center. 1,102 have tested negative. Still only 3 positives that are there. 2 tests were administered yesterday. We're still pending the results of that. And 19 of the total tests have been indeterminate. They did not yield a result either way and must be redone. We'll jump into our T3 strategy, our test, trace, and treat. You're going to get a more detailed update on some of the specific actions around this from Nick Mascione in a minute. But today we're reporting 3,572 tests. This is a high for us in San Diego County, our single-day high, and it does not appear to include any significant batching of delayed test results. Oftentimes we report out with an asterisk that we got a huge batch in, but this does appear to represent and reflect our continued effort to increase testing. It doesn't mean that we won't have ups and downs as we move forward, but I think when you look in a minute, you will see a continued upward trajectory of testing. Our goal here actually aligns with some guidance that's been put out by the state of California for the types of numbers that they would like to see. And so we are going to continue to strive to hit that goal and continue to work. But we're now well over 72,000 tests performed to date. Contact tracing at 163. Again, we have an initial goal. We will much likely need more individuals than that. But as Dr. Wooten alluded to yesterday, the number of tracers we need in both case investigators and tracers is directly tied to how many tests we're able to perform. And so both of those numbers should continue to rise together. 191 individuals are presently receiving help in our public health motel rooms, bringing us to a cumulative total of just under 600. Today we are reporting 233 new positive tests. This is a significantly larger number, but it is vitally important that we put this in the context of it's also our single highest day of testing throughout the evolution of coronavirus, which is why we emphasize and stress that you have to look at the percentage of positive tests and not the total number of positive results. It's a percentage of positives out of all testing done. You'll see us right there at 7% today, which generally tracks along with where we have been going throughout the evolution of this. So very good news and encouraging news on the increase in testing that we see right there. Next slide, we will look at our current hospital census. What you will see here is 139 COVID-related in the ICU, 387 total COVID-related suspected and confirmed hospitalizations in San Diego County. Now you might note that the 387 puts us a little bit higher than what we had been running throughout much of April. But a part of that is attributed to, if you look at 4/28 there, April 28th, we jumped up to 381. That corresponds with the date that 2 additional hospital systems, Paradise Valley and Alvarado, begin reporting their numbers to us. And so we think that this uptick, now you see us at kind of running a little bit higher in that kind of 381, down a little bit today at 387. I think that that trend that you see right there between April 28th and today is more a reflection of more accurate reporting, bringing all the hospitals online, than it is a reflection of an increase in regional hospitalizations. And so just want to put that in the proper context for you. We'll jump to our next one and we will see where we are as a total. Again, if you look at that dotted line at the top, you see that increase which occurred on 4/28 in our current bed capacity. We had an additional increase with 2 additional hospitals begin reporting their bed capacity. So that is why that line is moving up. But you will see that today we are standing at 3,961 total beds in use. This includes both COVID and non-COVID patients at all of our non-federal regional hospitals. Final chart here is our cumulative totals, 4,662 cumulative positives to date. Our estimated recovery at 2,657. There you see cumulative hospitalizations with doubling rate at 31 days, cumulative ICUs, doubling rate every 40 days, and then the unfortunate loss of life. With that, I would like to turn it over to Dr. Wilma Wooten for a Public Health Officer's report.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and welcome to today's briefing. Today's statistics for COVID-19 continues to increase due to the local increasing testing abilities. The global, national, and state statistics, based on data from the Johns Hopkins dashboard obtained at about noon today, are as follows. Globally, there are over 3.9 million positive cases, including over 272,500 deaths. Nationwide, the United States is reporting about 1.27 million positive cases, including over 78,000 deaths. Statewide, over 62,500 positive cases are reported, and this includes 2,548 deaths. And today, the County of San Diego is reporting 4,662 cases, which is 233 more cases than yesterday, as well as 169 deaths, which is 4 more than reported yesterday. Of the total number of cases that we are reporting today, 4,662, the age range again has not varied from 3 months of age to 100 years of age. We still have, the total number still represents 51% of individuals that are between the ages of 20 and 49 years of age. We have 49% female, 51% male, And today, we are reporting 919, or 20% of the cases, have been hospitalized, and this is 37 more than reported yesterday. Of the total number of hospitalizations, that includes 289 individuals that have been admitted to the ICU, and this is 6% of all of the COVID-19 cases and 31% of the total number of those hospitalized. The 169 deaths represent approximately 4% of the total number of cases. And of the 4 additional deaths, these include 3 females in their mid-70s, early 80s, and early 90s, and 1 male in his late 50s. Also, of the 169 deaths, 44% are female and 56% are male. And all of the additional deaths reported today had underlying medical conditions. Regarding race and ethnicity, we have data for 92% of the 69 of the total number of deaths, and this means that we do not have race and ethnicity for 14 of that total. Of the total for which we have these data, 73 or 47% are white, 63 or 41% are Hispanic or Latino, 11 or 7% are Asian, 4 or 3% are African American, and 2 are, which is slightly over 1%, are Pacific Islanders, and we have 1 each for American Indians and multiple races. As always, our sincerest sympathies and condolences go out to the family and friends of the individuals that we have reported today who have succumbed to COVID-19. In summary, as has been reported, we are excited that our testing numbers are increasing with a total of 72,634 tests performed regionally. And as a reminder, all of this information can be found on our website. That is at the bottom of most of the slides shown here and on the placard in front of me. So regarding outbreaks in congregate and community settings, today we are reporting a cumulative total of 61 confirmed active outbreaks. 1 new outbreak is in the congregate facility. We have 39 congregate facilities. This 1 new outbreak reported, and 1 outbreak reclassified since yesterday, which total number of cases includes 1,110 and 85 deaths. We have also 22 active outbreaks in community setting locations, 2 new outbreaks reported there, and cumulatively, this includes 191 cases and 5 deaths. I would now like to invite back to the podium Chairman Cox. Thank you.
Thank you, Dr. Wooten. Before we go to the questions, I'm going to introduce one more speaker. There's been a lot of questions that have come up over the last few days concerning caseloads in South County, and we wanted to address that further. South County is where I live and have raised my family, and I want to assure you that we are closely monitoring that part of the region, but we also are being active in response, particularly with regard to the testing. So here to talk about that today is Nick Machione, who is the director of our Health and Human Services Agency. He's also our leading our T3 effort, which includes testing, tracing, and treatment. And he's got some updates. So Nick?
Thank you, Chairman Cox. Partnership and coordination regionally continues to be the cornerstone to our strategy and implementation for T3. We're stepping up from our traditional role as the safety net to both coordinate and provide high levels of services in the form of testing, tracing, and treating. Starting with testing. Our county lab testing task force continues to meet and refine a regionally coordinated, data-driven, and equity-focused approach to testing. Our hospitals, our community clinics, medical groups are stepping up, bringing testing to their patients and their employees, both in the hospital setting and the primary care setting. And our public health lab is supporting our targeted testing approaches for vulnerable populations as well as dealing with case outbreaks. For instance, this weekend, we have our mobile testing in southeastern San Diego. And on Saturday, it will be at the Euclid Health Center from 9 to 3 p.m., and Sunday at the Jacob Center from 10 to 2 p.m. And I might add, it might be a great Mother's Day gift to go get a free test. And appointments are going fast, so please call 211 to book an appointment. And our 3 state testing sites have also been a great addition to our county, and as shown by the numbers in our increase in tests. Bottom line, we continue to look for more ways to increase our testing sites, and it's done with our partners throughout the entire county, using data to guide our planning efforts, and our progress is showing we're going in the right direction. As Supervisor Cox mentioned about the importance of expanding in South Region, let me share a few of the major highlights of what we're doing. Now, with the state walk-in testing site up and running in Chula Vista, we're looking to repurpose our previous drive-up testing site that was in South Chula Vista, and we'll have more information on that in the coming week. In National City, we're working with the mayor to see how we can partner to do testing as part of the city's food giveaway in concert with the San Ysidro Health Center. In collaboration with Paradise Valley Hospital, our county public health lab is assisting the hospital in its expanding of their testing as well. And in Imperial Beach, we're working with the mayor and the Imperial Beach Community Health Center to provide testing in their city and provide access to the broader community of Imperial Beach. And lastly, in San Ysidro, we're working with the San Ysidro Health Center, who is going to begin testing their patients. In all of these, it's about collective efforts of how we're trying to address the needs of our community members, addressing equity among our vulnerable populations, and we're engaging in conversations with all of our partners who work with and know these communities best, such as our Native American partners, our community-based clinics, as I mentioned, stakeholders in our rural communities, our conjugate care facilities, our skilled nursing facilities, our residential drug treatment facilities, and the list goes on. This is a lot, but I must add one important caveat. Our state, one of the leaders in the nation around testing, but also the rest of the states are embarked on an unprecedented campaign to test a large part of the population. And as a result, the supply chain is beginning to thin. We have elevated the urgency, and the state is well aware of our needs, of the facing shortages into the future. And as the state is helping us and our fellow counties, we are also aggressively pursuing additional resources in the open market. Now, on the subject of tracing, we have seen a steady increase in the ramping of staffing, and this is important. These individuals will be investigating every COVID-positive case that's turned up by our county public health lab and labs of each of our hospital and healthcare facilities that are conducting testing throughout our county. In the coming days and weeks, we're going to be seeing jumps in the number of staffing of folks that we are onboarding and training. This will become particularly important both in meeting the governor's requirement for protecting the public's health, but for also further in reopening the economy. Our test and trace efforts are working hand in hand in gathering the data that allows us to hone in on hotspots. So both those hotspots, be it in business and communities, so that we can prevent the spread of the virus. Simply put, there's no population and no person we can afford to miss. Now, the third component of the T3 strategy, treatment, stands strong. We have the capacity on board and in reserve to serve and help our fellow San Diegans in need. As testing and tracing increase, you're going to see the numbers that we are caring for in our public health motels also increase. And our team is thinking creatively about additional ways we can deliver services with our community partners to those who are quarantined, but who are facing a shortage of supportive services, and we will be there to help them. And I'll end by thanking an important group of our T3 strategy. I mentioned our community partners, a whole cadre of community partners and from all forums, and our county amazing team. But in particular, just recently, there was a celebration of National Nurses Day. And I'd be remiss if I didn't thank our nurses, all of our nurses in the county, in our hospitals, in our clinics, who have been doing heroic work in all three aspects of our T3 strategy. Thank you. Now I'll turn it over back to Chairman Cox.
Thank you, Nick. And I have to tell you, there's some encouraging news of heightened response to the coronavirus in our neighbor to the south in Baja California. Our Regional Border Unified Command is working with authorities there, and they report that a team from Doctors Without Borders has arrived in Tijuana to staff a COVID field hospital set up inside the arena of the Tijuana Zonkees basketball team. The team is composed mainly of doctors from throughout Mexico, and this field hospital will be receiving recovering patients from the Tijuana General Hospital and providing care for 50 patients at a time. In addition, the Mexican Red Cross erected a 25-bed COVID field hospital at the Ensenada General Hospital grounds. It's managed by the State Health Department, and the Red Cross will be equipping and staffing when it becomes necessary. Well, we've talked a lot this afternoon, so let's get right to the media questions. We'll go to the first question, and again, just make sure you speak clearly into the phone so we can better understand your question.
Alexis Rivas with NBC7, please state your question.
Why are you not enforcing the face mask order? San Diego Police and San Diego County Sheriff's spokesman told me today that over the last week they haven't issued a single citation for not wearing a face mask. So if we're not enforcing that order, how can we reopen safely?
I think Dr. Wooten's going to respond. We, again, hope everybody will comply with the requirement to have face coverings, but Dr. Wooten can tell the importance of it, and we can go from there.
Not a long explanation, but given this is a new order, what our law enforcement, particularly the Sheriff's Department, is doing is handing out face coverings so that people get used to the idea. So we are giving people time to become acclimated to this, and we are giving out face coverings at this current time to give people the opportunity to get used to it.
At what point are you going to switch from handing out masks to enforcing this as a misdemeanor?
Law enforcement would make that decision, and you can certainly call our Sheriff's Department or any of the jurisdictions throughout the county based on the area that you are concerned about.
All right, thank you, Dr. Wooten. I have a question from Monica Dean from NBC7. Can you please clarify if there have been any changes to the stay-at-home order as it pertains to private gatherings at the maximum number of people allowed to gather?
So at this time in stage 2, there is no gatherings. No gatherings in stage 1. Today we are transitioning to stage 2, no gatherings. That guidance will come from the state, but at this point in time, stage 2, there still are no gatherings. What is being done is allowing a slow expansion of businesses to reopen with the curbside pickup, as was described by Supervisor Fletcher. But there are no gatherings at this time of any kind. The only order that we have in place is related to childcare, where now 12 children or less can be in a designated area with designated staff. Sure.
If I could just make a small comment on that. Let me take my mask off here. Sorry. Actually, we did have a recent cluster of cases that resulted from a dinner party that was held at a private home. And it was unfortunate that, it was fortunate the number of people were small, but it was unfortunate in that we were able to trace a specific cluster of cases to that specific type of event. So I don't think that people should take the fact that we are doing a lot of things to loosen up our economy and to make things get back to normal as an indicator that we should lower our guard against this virus. So it's very important that in our neighborhoods and with our gatherings that we adhere to Dr. Wooten's health officer order, because it can have consequences.
Dr. McDonald, can I keep you there for the next question from Hunter Sowards from KUSI. Supervisor Kristen Gaspar called some of the governor's criteria impossible to meet, like 0 deaths and less than 25 cases within 14 days consecutively. From a medical standpoint, what is the response from the county health leaders? Since we have done well to slow the spread, shouldn't we now have the ability to decide how we move out of this crisis?
Well, I think really all I can do is address what's happening medically, and I can tell you that it will be very difficult for us to reach a goal of no deaths from this disease anytime in the near future. And really, that's all I can say to that kind of question.
Thank you.
And I just wanted to add it that while we know that we cannot achieve that metric, but I think the actual determination of those metrics is intentional to allow smaller jurisdictions to begin opening up, and then at a later point, larger jurisdictions, medium to large jurisdictions, then will be provided with the metrics so that we can all elevate more closely together. But if we allowed a larger opening up of large jurisdictions, you probably would see more of what Dr. McDonald just described.
Thank you, Dr. Wooten.
This next question deals with testing at the convention center, and Supervisor Fletcher will respond.
Yes, this one is from Lisa Halverstadt, and she wonders what the timeline is to test convention center shelter residents who still need tests.
Yeah, so the testing at the convention center is going to be an ongoing evolution and exercise. There's essentially a goal to perform 600 tests per week on a ongoing basis. The aim of that is to repeatedly test the individuals who are there. It's also been made clear to all of the residents who are there that testing is not an optional exercise, and so as we go through the testing, they will be required to comply with the testing. Now that we've been through an initial iteration, we've had time to socialize it, time to educate, time to share with folks the benefits of it. But the testing evolution at the convention center is going to move into a new phase of an ongoing operation to ensure 100% of residents who are there are tested along with the staff who are in place. And so I think we will begin to see the daily numbers of tests being performed continue to ramp back up starting next week on an ongoing basis. But the goal there is to get universal compliance. It will be a requirement for everyone who's there, and we will, in certain instances, once we've gone through everyone once, begin retesting the same individuals.
Oh, I do have one more. This is from Lindsay Winkley with the Union Tribune. She is wondering if the changes to the region's health order with campsites, et cetera, go into effect today.
They do, right? Yeah, they do. They go into effect today. The changes around childcare, recreation, outdoor recreation, all of those go into effect today. And they are going consistent with the governor's order on the reopening businesses at the beginning of stage 2 as well. Midnight today.
And this one is from Claire at KPBS. Yesterday, Supervisor Fletcher said the county is increasing child care to groups of 12 children or less. Is that only for essential workers?
No, we don't have that restriction in place. You know, our sense is it'll be primarily utilized by essential workers, but it'd be an undue burden on our child care providers to try and ascertain that, so that it's not addressed in our order. So technically, it would be available to anyone.
Well, that concludes our questions for today. I can't conclude without mentioning that obviously this Sunday is Mother's Day. And to all the moms out there, we want to certainly wish you a very happy Mother's Day. We know it's going to be a little bit more difficult to celebrate Mother's Day this year, but I encourage all families to enjoy the day. More than ever, let's celebrate moms and count the blessings of having our loved ones near us. And just a reminder that we will not have live media briefings either on Saturday or Sunday of this weekend, but our communications office will send out updates to the media. And of course, you can check our coronavirus website for the latest information on the virus. With that, we will meet again on Monday at 2:30, and we hope you have a very enjoyable weekend. Thank you.